Yeah. Now, how did I do that last time? Okay, so today we're going to do a few more scenarios. Okay, so when you want to attempt the answer, can you please just tell me your name, okay, so that I know who you are when you are answering. Okay, so anybody else? Are we waiting for anybody else? There are 48 here. How many absentees?
3 absentees.
Okay, so that's
I think
48
can start
already.
now.
All right. Okay, we'll start, yeah. Okay, so hang on. How do I do this? I forgot already macam mana nak buat tadi tu. Oh, what did I do? Sorry. Okay, so who would like to start? So we've got two pictures here showing the shade taking procedure. Okay, bila you buat crown and bridge, you need to take shades, especially for, well, not especially lah, or even for posterior teeth pun we still take shades. Okay, so who would like to start? I'm trying to see, how did I do this last time? I cannot see the question properly. Okay, who wants to try to explain question number 1? Yeah, I forgot already how to do this. Wait, let's do this. I cannot see the questions properly. Can you see this clearly or not?
Yes.
Okay. Okay, come, let's start. Everybody wake up.
I want to try first, Doctor. Prof.
Okay, please remember to say your name first, okay?
My name is Aminul Hakim, number 25.
Okay.
So based on the pictures given, I think the correct positioning for the shade guide should be the picture A.
Okay, why do you think so?
Because it is placed next to the tooth guide. The shade is placed next to the tooth guide. And for the picture B, it is placed a bit front.
Okay, right.
So
Anybody else? So, continue. So
the lighting received is not the same.
Okay, right. Anybody else?
Prof, I'm Zuhaira.
Okay.
I think the answer is B, because we can compare the shade guide to both mesial and distal teeth.
Okay. Right. Anybody else?
Me, Prof. Me, Yana, number 4.
Okay.
I think the correct positioning of the shade guide is B, because not only we can compare with the adjacent tooth structure, but also the overall original tooth color.
Okay. Right. One more person.
Prof, can I try? My name is Sarah, number 46.
Okay.
I think the correct positioning is B, because once you put it in that position, you can see how the overall smile will look like with that shade when the crown is done.
Okay. All right. Okay. So Aminul, you're on your own here. Okay, but anyway, it doesn't matter. It's a discussion here, remember? So we are not saying who's right or wrong, but we are discussing, and what is incorrect, we correct it, okay? So of course, taking shades can be, siapa bagi shade taking lecture ya? Anybody give shade taking lecture?
Rasanya
Siapa bagi? Belum? Not Dr. Aisyah or Dr. Noor? Tak ada. Okay,
Dekat
anyway.
lecture tak ada, dekat klinik macam tunjuk.
Oh, ya
Habis
ke? Okay.
kasih
Alright.
dia.
Okay, so just a clinical, in the clinic je lah. Okay, you were ni. Okay, never mind. Well, it's not so difficult pun. Okay. But for question number 1, okay, ideally I would have done in picture B as well. Okay. The only reason is because if you put the shade guide in the position of the tooth that you are going to crown, okay? Or let's say if you're doing a bridge, you put it in the position where the edentulous, where the pontic is going to be, okay? So you have a better idea of how the shade will look generally in the mouth, okay? So if you put away, like in picture A, okay, not to say that you cannot get the shade, you can, because you are comparing it to the adjacent to that tooth to one, okay. But kadang-kadang the colour of that crown, the tooth yang you dah prepare tu, can actually deceive your eyes, okay. So you might get a wrong perception of the shade, okay. So it's always best to put it in the position of where you're going to do the crown, or in the edentulous area, or in the pontic area, okay, if it's a bridge, right? And better yet, if this patient, if the lip can actually close down on the shade a bit, okay, so that they're, macam ni, they're very open, kan? The lip is above that. Patient might have high smile line, so that doesn't matter, okay. But if it's nice, if you can also get the patient to relax, so that you can see, it's almost like you're replacing the tooth there already, okay. All right. So the best is actually position B, okay, Aminul? Not to say that you cannot do position 1, okay, but the best is to position it in the area where you're going to replace with the crown or the pontic area, okay? All right, now question 2.
Prof,
Yeah,
I have a question.
okay.
What about some literature says that when we are taking shade selection, we shouldn't put the shade guide next to the abutment.
Kenapa tak boleh letak next to the abutment?
Dia kata letak atas atau bawah.
You mean abutment ke adjacent teeth?
Adjacent, sorry.
I don't know about that. Okay, maybe there are different ways, but I think as far as I know, to my knowledge, the best is actually if you can actually place it in the actual place where you're going to replace the gigi. Okay, so you get a better picture. Now sometimes kalau gigi tu ada different shape, okay, because it could be that cervical dia a bit kuning, body dia nampak a bit more of a different color, and then the incisal edges is a bit translucent, so you have a different tone there, okay. So you might want to check if the incisal edges, for example, if it's like a bit bluish, so it could be a different shade, so you might check with your shade guide at the incisal edges, okay. But if you just put at the incisal edges, again, you might not get the correct or ideal shade for that crown. Sebabnya you will only see the bottom part of the gigi. You will not see the whole surface of the gigi. Okay, I mean that's my view, and that's how to my knowledge, that I have always done and being trained doing that. Okay, but yeah, I mean, there could be, I don't know what the article is saying. Okay, so maybe there's a reason why they buat macam tu. So maybe you can if you can share what the article is saying, that would be great. Okay, so to know what, so that everybody will know why, what is the reason dia buat incisal edges tu. Can you share that? Do you have that
Maybe next
information?
class.
Okay, all right. Okay, so yeah, just this, so that I mean, it doesn't harm for us to know a bit of extra knowledge, kan? Okay, so that's fine. All right. Okay, so let's do number 2. Who's talking?
Hello? Can anyone hear? No.
Yes.
Oh,
Hello.
I can hear. Okay. Hello.
Okay.
My name is Shahid.
Okay.
Okay. I'm gonna try question number 2.
Okay.
First and foremost, we have to clean the tooth using paste or any prophylactic paste. Clean the surface of the tooth, and then after that, make sure to have a proper lighting. Means that natural lighting, and then we take the shade guide and then put it close to the tooth in the adjacent, or I'm not mistaken, the theory just now doesn't put adjacent because of something called binocular effect.
Well, I did not come up with that word just now. But what do you mean not putting at the adjacent? I think I said put at the adjacent.
Put adjacent, yep. But put at adjacent, and then after that, don't put more than 7 or couple of seconds to prevent strain of the eye. Then make sure that we take on the shade selection based on 3 areas: the gingival area, the body or the tooth, and then the incisor area of the tooth. That's all.
Okay. Anybody else want to add?
Doctor, my name is Nani, number 5.
Okay.
I want to add on.
Siapa? Sorry.
Nani.
Okay.
I want to add on for the female patient who's wearing lipstick, it should be removed because the bright color lipstick will affect the perception of the shade.
Okay.
And then make sure that the tooth is hydrated, because if the tooth is dehydrated, the shade will change a bit.
Okay. Any more addition?
And remove any bright colors, like avoid wearing for the patient wearing bright colors also.
Okay, tapi kalau patient dah datang dengan baju bright colour, macam mana nak suruh dia buka baju? What do you do?
Prof, can I try? My name is Athena.
Okay.
It is recommended to use a bib that is light blue or grey in order to help with the perception of the colour.
So you can cover with your bib lah, okay? So if the patient dah datang dengan bright colour, or if you remember to pesan to the patient next time when you come for crown prep or impression or whatever, don't wear bright colour baju, okay? So then it's okay. But if patient dah datang, yes, you can use the bib. Okay, continue.
As for the light quality, Actually, it is better to position the dental chair facing the window, and the natural morning to noon time light is the best to view the color. And also for the shade selection, based on what I read, it should be done at the start of the appointment before the teeth are cleaned, so that it won't be dehydrated when it's right. And when we observe, the dentist should observe the patient at an eye level, because this is where the retina is most sensitive to the color. And for the dentist, they should also wear natural color gloves, and ask patient to remove lipstick. And also, if possible, it is best to color or paint the room walls and floors with light gray or with light blue or gray colors.
Okay, so okay, quite a bit addition there. Okay, anybody else? Last person?
Doctor, Nur
Yeah.
Haris.
Okay.
Nur Haris 29. In several literature, it is mentioned that the shade procedure, the shade guide procedure need to be taken at a multiple visit to really confirm the color of the teeth before it is being sent to the laboratory. That's all.
Okay. Anybody else?
Doctor,
Yeah.
number 50 Yusuf.
Okay.
I want to mention about the reference point that I use for shade selection. Is it okay?
Okay.
First is side of the nose.
Okay.
Side of the nose ni dia tolong find out the hue and the chroma and value.
Okay.
And then under the lips also, where there is an incisor edge exposed. And then this gives idea of how the teeth will look like when the patient is relaxed. And the third one is actually the under the lips, when the mouth is wide open and the cervical covered. And then this gives you an idea of how the teeth will look when the patient is smiling. And also, women tends to have better selection in shade selection. I tak tahu lah apa lecturer cakap. Nanti Dr. Noor cakap pasal.
Okay, I'm not so sure either. Okay, but maybe a lot of I think maybe I'm not sure. I'm just guessing. Okay, just hypothetically, I think why they say female is better because female jarang ada problem with color selection, isn't it? Like even you know, like what do you call that? What do you call that yang bertukar-tukar colour tu? Like green and red or something. I forgot what's the word.
Color blindness.
Okay, color blindness. Okay, so you that I think that occurs more in male. Okay, but in terms of this, generally, I don't think you have so much problem whether you're male or female because this doesn't involve a lot of colours yang macam, you know, those red, green or whatever tu tak ada sangat lah, okay? But yes, okay, you've given some good points here. Yes, you should clean the tooth because kalau gigi tu ada staining ke or lots of plaque ke, it has to be cleaned before you take the shade guide, okay? So somebody said tadi to do at the start of the treatment, which is good. Kalau you have planned for you know, crown and bridge for the patient, you may want to do it when you have your examination, during you do your examination, okay? So you can do that. You can do at just whatever existing condition the gigi is, and you can do one after cleaning, okay? Because most of the time you will always do, you know, you will always stabilize the oral condition first. Scaling, you know, if you have to do filling, whatever, if the adjacent teeth ada caries, you need to do that bit first, okay? So you do that. So siapa yang cakap tadi not to clean the gigi tu, I don't really agree to that because I think you should clean the gigi to get a better picture of the shade, you know, for your shade selection, okay? So you cannot take shade dengan gigi. You know, sometimes you got food stain, you know, kuning-kuning and whatever. So unless if it's already memang it becomes, dia dah macam becomes part of the surface of the gigi, then it's a different story. Okay, so multiple visits. I don't know. I'm not really sure about multiple visits. Depends, I suppose, on the patient's situation. Kalau you rasa masa mula-mula you jumpa dia when you first see the patient, the gigi is like a lot of stain and things like that. And then after a while, you've been doing some treatment, scaling, polishing, you've been stabilizing the oral condition, and then you want to choose the selection again. I suppose that's okay. But whatever it is, the tooth must be clean and it has to be hydrated. So the best is always before you do the crown prep. Okay, so if you do the crown prep, not to say the best, meaning at whichever point of the appointment you jumpa the patient, okay, before you do any treatment, like the patient the teeth are still hydrated in its natural condition, you can do the shade selection. Okay, so if the tooth is, katalah if you terlupa, right, and then suddenly at the end of the treatment you remembered, oh, I haven't done this shade selection. Okay, so you don't you let the patient rest for a few minutes, let the patient rinse so that the saliva will just rehydrate the surfaces, and then you take the shade selection. Then you get probably a better idea, okay, or not idea, you probably get a better match to the adjacent teeth. Okay, so that's those are good points. And yes, if you have to remove, actually in any treatment, kalau female patients, when they come in wearing lipstick, I always get them to remove the lipstick, because not only for shade selection, even to do restoration, because sometimes what happens is, the lipstick will just get stuck on my glove and then it gets onto my composite and things like that. So I don't want that to contaminate my dental materials or whatever the surface of the tooth that I'm doing. And also it will smudge the patient's face sometimes, okay? And then if you use rubber dam, then it will go, everywhere on the rubber dam. So I always get them to remove the lipstick before they do the treatment, okay? So yes, please get them to remove the lipstick, because that can also cause some deception of your shade selection, okay? Not too long. Yes, usually what I like to do is when I do shade selection, I in my clinic, I'm not too sure about the one we have. I pun dah tak ingat, dah lama tak masuk klinik dekat kita punya faculty tu. We have one with just like a row of shades, okay, from A1 to or B1 to whatever lah, okay, or the A, B, C, D is there. Then I have another one which is a 3D shade guide, okay. So on the first, what I usually like to do is first I just use the single shade guide too, and just run my shade along and see which is the range of color the gigi is, okay. Then I know kalau the gigi is more in the C shade, then I will choose from my 3D shade guide, I will choose the more of the range of the C shade, okay. So you can do that, just get an idea, okay, just quickly, and then you don't immediately do again, okay. You just wait a while so that you punya mata tak fatigue, okay, of the color, and then you go and do the definitive shade selection, okay. So you take a range first, and then if you think like, okay, dia ni gigi dia range dalam maybe A2 A3, then you can pick out the shade A2 A3, okay. Wait a while, okay, do lah whatever you have to do first, then before you start the crown prep, you take the shade, okay. Then you get the view better, okay? Your eyes will perceive the shade better. In terms of lighting, that's very important. Now, Athena, we cannot be moving our dental chair around because it's fixed on the floor, okay. So if you want natural lighting, sometimes I don't know, when you were in clinic before, you might have seen me with your seniors going over to the window with the patient and trying to get the shade under natural lighting, especially if it's gigi depan lah, okay. So we go to the window, get natural lighting, and then we sit in the chair, and we also use the chair light to see the shade, because you see your patient will be in natural light, and sometimes they can be in room light. Okay, so you probably need a bit of both situation or condition, okay, to select your shade, so natural light and room light or chair light. Okay, so so that you can see that, okay, this is the actual shade for the patient. Okay, so yes, you need that. And yes, like I've mentioned before, sometimes you get these tones of colors on the surface of the gigi. So you might want to select the shade for the cervical, okay, especially kalau patient to have a very high smile line. Okay, bila they smile, you can see the gigi, full length of the gigi. Okay, so some people will have very, very high smile line that you see a few millimeters of the gingiva. Okay, so you might want to choose the color accordingly, right? And somebody was saying about the lip position, the nose position. I hardly do that, to be honest. Okay, but the lip position, yes, I do. Okay, I get them to relax, and I put the shade guide underneath on the, for example, in picture B, I put in front of that tooth, the crown, that I'm preparing for the crown, and then I get them to relax. So I get the lip to go over the shade guide, okay, and I see there. Then I get an idea of probably the incisal third, okay. Maybe the shade tak sama. Maybe if I chose B1, for example, then the color is too white at the incisal edge, so it's may need to be a bit grayish. So then I have to go and find a shade that's probably around the C's or maybe D's that's a bit grayish, okay, and choose the incisal edge color, or and then get the patient to go smile as normal smile, okay. So that will tell you whether the patient has low smile line or whether the patient has moderate smile line, and then probably get the patient to laugh or open as wide as you can, okay, and then so that the lip, it goes to the maximum extent that it will open, and you can see the whole tooth and compare the cervical area for the shade. Okay, so is that clear? Any question there on shade taking? Yes? No?
Yeah.
Okay? Okay, we have about 8 minutes on this session. Okay, let's go to the second one. Okay, why is it not moving? Okay. All right. So, this one, okay, so it is asking you to describe the radiographic appearance of T3738. Okay, so describe. Siapa nak describe?
Prof.
Yep.
My name is Aina.
Okay.
For 37, there is distal occlusal loss of the crown. The distal occlusal of the crown is lost, and there is radiolucency involving the enamel and pulp and dentin. And for the there is slightly widening of the PBL space at the apex of 37.
Okay.
And for 38, there is almost completely loss of the tooth structure and radiolucency involving the dentin, enamel and pulp, and also yeah, that's all.
Okay. Anybody? Who are you tadi?
Aina.
Okay.
T1.
Anybody wants to add or want to give their radiographic appearance of 3738?
Prof. Ghazlan here.
Okay.
There is discontinuity of lamina dura in Q7.
Okay.
You want the diagnosis, is it?
I want the question asked radiographic appearance.
There is aperture radiolucency.
Okay.
That's all I can see.
Okay. Anybody else?
Prof, can I try?
Okay, whose eye?
Isaac.
Okay.
Isaac, number 20.
Okay.
So, there is a radial lucency on distal occlusal of 237 with palpal involvements, indicating deep caries. And there is a radial lucency at the mesial and distal root apex of 237. So on 238, there is a radial lucency on the crown, indicating tooth decay with palpal involvements, and there is also radial lucency at the both root apex of 38 that may indicate apical periodontitis, depending on the the symptoms of the patient, either is acute or chronic.
Okay. Right. Anybody else?
Prof.
Yeah.
I am Amar.
Okay.
Number 26. I want to add a point on 238. The radiolucency area already until the cervical third of the root.
Okay.
That's all.
Okay. All right. Okay. So basically, all of you answered generally correct about what you saw in the X-ray. Okay. Maybe the terminologies used is not entirely accurate. Okay. But for example, you can, kalau I describe this, I wouldn't really say disto-occlusal or mesio-occlusal. I would probably answer more on coronal structure. Okay, you can see radiolucent areas on the coronal structure. Okay, okay, when you answer question macam ni, you kena anggap yang you tak tahu bukan you tak tahu, you haven't looked at the actual condition in the mouth. Okay, so bila you answer this like Isaac, how you answered, you mentioned that it's a possibility, it may indicate. Okay, so that's how you should answer. All right, so when you look at this, you see radiolucency on the coronal part of both 237 and 38. Okay, possibly indicating well, definitely kalau you tengok dalam mulut, it's already, you know, the caries is going to be so huge. Okay, so possibly indicating a coronal tooth structure loss or caries. Okay, a large caries in the mouth, and you can say it's extending into the pulp chamber area. Okay, and you've mentioned all of you have mentioned widening of the PDL. Best for you to say mesial and distal root. Okay, because sometimes you might just see on a mesial root, not on a distal root. Okay, like 238 doesn't have that much of periodontal PDL widening at the root, but more on the apical, right? So you can say periapical radiolucency of both roots 37 and 38. Okay, right? So basically, you've all described what you see lah. Okay, so that's good, right? Okay. Sometimes, if like how Isaac answered, if you want to indicate the possible diagnosis, you can, but you need to answer in a way that it may be that it is possible that, okay, because you tak tengok oral clinically, you tak nampak, you don't have that unless there's a picture of oral condition. If we put a picture of a clinical picture, okay, intraoral view of these teeth, then you can say the diagnosis. Okay, all right. What would be your treatment plan for this patient, for this teeth? Sorry. Okay, come on. There's 40 something of you in the class. Okay, who's that?
My name is Farhana.
Okay.
Based on the radiograph that I can see is, I don't think RCT can be done because this tooth seems like all the corona portion almost lost, so it is not restorable. So the only option that I have is to do
Okay, hang on,
extraction.
Farhana. So hang on. I'm going to stop you there because we've got less than 1 minute. So I'm going to end this and go to the next link, okay?